You're watching CTOM TV. Knowledge is power.
Johanna wants to know, can ER-positive breast cancer become triple-negative breast cancer?
Yes.
Meaning, can one type of cancer change to another? I know she's asking about breast cancer specifically, but...
Yes. Well, there's a lot of confusion on this. I think it's important to have some explanations on exactly what is triple-negative breast cancer and what is breast cancer in general, and how it's defined. As you know, there are 3 receptors that are typically used in breast cancer right now. It's the estrogen receptor, the progesterone receptor, and also the HER2 receptor. So breast cancer is defined by what receptors you have, and these receptors are on the outside of the cell. And so when they do your pathology, they look at these receptors and they determine exactly which ones you have. So if a person starts out with estrogen positive breast cancer, in other words, their breast cancer cells express this receptor, what can happen over time is the receptor component that sticks outside of the cell can break off. And so what happens is the internal components of the receptor still continue to signal the same pathways. They just don't need binding from the estrogen on the outside of the cell. And so as a consequence, you still have estrogen positive breast cancer, but you don't see the presence of the receptors. So some people will mistakenly say that it's a triple negative breast cancer now because it's lost the cellular portion, the external portion of those receptors.
And what kind of test would an oncologist be running to find out whether that receptor is there or isn't there?
Well, that's a pathology-based approach, but it doesn't really change the genetics of the cancer. It's still going to be using the same signaling pathways. Whereas triple-negative breast cancers that start out as triple-negative breast cancers and don't have estrogen expression, they're going to have numerous different pathways. And so you have to really look at the mutations that are unique to each case to really define what type of cancer.
So in this case, you couldn't just use standard pathology to determine how best to treat this person.
Well, you could determine that they don't have receptors anymore, but you have to look at their history and see were they ever estrogen positive.
Right. So if they were, and now
they're still estrogen positive breast cancer. They just won't respond to drugs that target the estrogen receptor. So it's really how you define it, and how you discuss what being triple negative is.
So so really, your cancer hasn't changed.
No.
Or your diagnosis hasn't changed.
In the terms of how a doctor would treat it, they would typically use a drug that blocks those receptors. And so you can't really do that anymore. And so we basically call this endocrine resistant when it reaches that stage.
Okay. So as you say, it depends on how you look at it.
It's not a true triple negative breast cancer. No. It's just endocrine resistant.
Right. And of course, what's important about understanding the distinction? For
the genetics, patient? The actual genetics and how you treat it and how it's going to respond to drugs.
Right.
That's everything.
Yeah. Because otherwise you're not going to get the treatment. You've now kind of been misdiagnosed if you're now being told you're triple negative. Right. And so you're going to not be getting the right treatment.
Right.
Yeah. Which brings us back to one of your favorite topics, which is
sequencing.
Genetic sequencing, because that's the way to tell.
That's how you fix that problem.
You're not wondering anymore.
Yeah, there's key mutations that you can use to define the subtype of breast cancer. That are common to different subtypes. It's called the consensus subtypes.
Okay, interesting.
Thank you for watching CTOM TV. Subscribe below and stay informed.